We will discuss the treatment of unexplained infertility according to ASRM 2020 and ESHRE 2023. We will discuss the differences and the similarities between both the guidelines for treating unexplained infertility. So according to ASRM 2020, they describe that ovarian stimulation with oral medication or injectable with IUI, and if it is not successful, then we can go for IVF. We will describe all these things in detail in the subsequent slide. This is just the beginning. According to ASHRAE 2023, we have to give the patient option like expectant management, ovarian stimulation plus IUI. So if the patient prognosis is good, we will calculate the patient prognosis according to the various prediction model. If the prognosis for the pregnancy is good, then we can go for expectant management for 6 months. If it is poor, then we can directly go for ovarian stimulation plus IUI. If ovarian stimulation plus IUI fails, then the patient will go for IVF. So the management include expectant management, second ovarian stimulation with IUI, third is IVF. And the recommendation is that the decision for the treatment will be depend on the prognosis of the couple with unexplained infertility. This is about ASHRAE 2023 treatment for unexplained infertility. We will describe this in detail in the subsequent slides. Bolo. This flowchart we have already discussed in the prediction model for unexplained infertility in one of my videos. Please see the video before going to the treatment of unexplained infertility. Let's discuss this flowchart again quickly. So according to this flowchart, we will calculate the natural conception rate for 12 months of a patient with unexplained infertility. If it is more than 30%, then we can give the patient 6-month expectant management. If it is less than 30%, then we can directly go for the ovarian stimulation plus IUI. And if it fails, that is we have already given 3 to 6 cycles, then we can start for IVF. This is the flowchart according to the prediction model, how we will give expectant management or how we will start the ovarian stimulation plus IUI directly. We will discuss different treatment available for unexplained infertility and what all are the recommendation for that. So first is intrauterine insemination in natural cycle, that is we do not have stimulated the patient with oral ovulagens. So as we know, IUI is the first line treatment for unexplained infertility, and but IUI in natural cycle is not recommended because what is the reason behind this is that it is less effective than ovarian stimulation with IUI, and it is similar to the expectant management, and the strength of evidence is level A. So IUI in natural cycle is not recommended in unexplained infertility according to ASRM 2020. Clomiphene citrate with timed intercourse. Clomiphene citrate with timed intercourse is not recommended for unexplained infertility. The reason behind this, it is not more effective as compared to the expectant management, and the strength of evidence is B. Aromatase inhibitor with timed intercourse. So aromatase inhibitor like letrozole with timed intercourse for management of unexplained infertility is also not recommended as it is not much effective as compared to the expectant management, and the level of evidence is type B. Gonadotropins with timed intercourse. Gonadotropins with timed intercourse is not recommended for unexplained infertility as it has same pregnancy rate compared to the ovarian stimulation with oral agents like clomiphene citrate or letrozole, and the level of recommendation is strength is B. So far we have discussed that IUI with natural cycle is not recommended, Clomiphene citrate with natural cycle is not recommended. Aromatase inhibitor like letrozole with natural cycle is not recommended. And also gonadotropin with natural cycle is not recommended. These all recommendations are from ASRM 2020. Let's discuss what is the recommendation made by ASRM 2020 about clomiphene citrate and intrauterine insemination. So they have recommended the use of clomiphene citrate with IUI as a treatment for unexplained infertility. And the strength of evidence is A. Let's compare it with ASHRAE 2023. They have also mentioned IUI with ovarian stimulation is the first line treatment for couple with unexplained infertility. So they basically say the same thing, that is ovarian stimulation plus IUI is the first line. Aromatase inhibitor with intrauterine insemination is recommended that it can be used as an alternative to clomiphene citrate as both have similar efficacy, but it is not FDA approved for treatment of unexplained infertility, and the strength of evidence is A. Let's see the recommendation on the combination of clomiphene citrate with gonadotropins. That is, we have given clomiphene citrate or letrozole with gonadotropin for ovulation induction, and then we performed IUI. The recommendation is that it is associated with higher pregnancy rate and also with increased risk of multiple gestation. So the pregnancy rate is increased, but the risk of multiple gestation is also increased. Thus, it is not recommended to use this combination, that is clomiphene citrate or letrose with gonadotropin for ovarian stimulation. And the level of evidence is B. Let's discuss what is the role of IUI with low dose gonadotropin. According to ASRM 2020, it is not recommended to use low dose gonadotropin for the treatment of infertility, unexplained infertility. The reason is it is more complex and expensive for the patient, and the likely not much effective as compared to the oral medication with IUI. And the level of evidence is B. According to ASHRAE 2023, they have mentioned that we can use gonadotropin low dose regime for ovulation induction, but we have to take care of what two things: the multiple pregnancies and OHSS, along with adequate monitoring of the patient. Thus, this is the difference between ASHRAE 2023 and ASRM 2020 guideline. In ASHRAE, they recommend that we can use the low dose gonadotropin, but in ASRM, it has clearly mentioned that we cannot use low dose gonadotropin. It is not recommended. Let's discuss about IUI with conventional dose gonadotropin. IUI with conventional dose gonadotropin is not recommended. Why is it so? Because it is as it is associated with improved pregnancy rate, but also it is associated with high multiple gestation pregnancy and its associated complication. That's why it is not recommended to use conventional gonadotropin dose for with IUI for management of unexplained infertility, and the level of recommendation is